If willpower alone could beat addiction, this video wouldn't need to exist. But it can't, so I'm here to offer you some new tools. Hi, I'm Dr. Kiki Fehling, psychologist, author, and expert in Dialectical Behavior Therapy, or DBT. Addiction is so often fueled by painful emotions. In this video, I'll be teaching you 5 DBT skills that can help you cope with emotional crises and the cravings they trigger. At the end of the video, I'll also address how DBT fits into addiction recovery, but for now, let's jump into the skills. Number 1, tip your temperature. This coping skill may sound ridiculous, but your nervous system doesn't judge it. It just works. DBT has 4 skills called the tip skills, designed to help you regulate your nervous system when you're overwhelmed by emotions or cravings. Tip your temperature is the first one. To practice, fill a sink or a large bowl with cold water and place your full face in the water. Or you can wrap a flexible ice pack with a wet paper towel and place it over your eyes and your nose. Then hold your breath for as long as you comfortably can. This skill directly impacts your nervous system through a body instinct called the mammalian dive reflex. When you put your face in cold water, your heart rate slows down, which is perfect when you feel emotionally revved up or agitated by cravings. But the skill works so well that if you have heart problems or other medical issues, you should talk to your doctor before using it. If you can't or don't want to dunk your face in water, you can also try drinking ice water, placing a cold pack on the back of your neck, or running cold water over your wrists instead. Even without the full dive reflex, using cold water can help you cool down physically and emotionally. Number 2, distraction with physical sensations. When your brain won't shut up about using, it's time to give it something else to focus on. Distraction is one of DBT's distress tolerance skills. One way to get your mind off of what's upsetting you is by grounding through physical sensations. For example, you could eat something spicy or sour. You could stomp your feet on the ground. You could smell strong incense or herbs, listen to loud music. Basically do anything that pulls your attention away from what's upsetting you and towards your physical senses. You can do anything that doesn't actually hurt or harm your body. It's so easy to get stuck in spiraling thoughts, ruminating about all of your problems or thinking about your drug of choice over and over. But the more you focus on these things, the stronger your cravings and painful emotions become. Grounding snaps you back into the present moment, out of your head. It can make it easier for you to step away from using towards other coping skills or healthy behaviors. Number 3 is alternate rebellion. If part of your addiction is about saying screw it to rules or expectations, this skill lets you rebel in ways that won't also wreck your life. Many people drink or use drugs partly because they're angry or bored with convention, with authority, or with themselves or their circumstances. Using may be a way to have fun, break free from responsibility, or throw a middle finger to the world. Alternate rebellion is a DBT skill that can help you satisfy those urges without negatively impacting your health or recovery goals. The idea is simple. Find ways to break the rules and feel that rush without using drugs. For example, you might dye your hair bright colors, get a tattoo or piercing, or wear unconventional clothing. You could say provocative things online, protest, or make lifestyle choices that go against what the people around you expect. The key is choosing rebellious activities that align with your values and long-term goals, rather than behaviors that just create more problems for you. Of course, what counts as alternate rebellion will depend on your specific situation and what genuinely feels good to you. The goal is giving your inner rebel a healthy outlet. Number 4, the please skills. The next time you want to reach for your drug of choice, ask yourself, should I reach for some food instead? The please skills are a DBT acronym I won't go through here, but here's what you need to know. Emotional health requires physical health. When you're physically vulnerable, like being hungry, tired, or sick, it's so much harder to cope with the stressors of life. Drug cravings can be harder to fight when your basic needs aren't met. Of course, taking care of your physical health is much easier said than done, and addiction can make it even harder. A simple way to practice this skill is to ask yourself, right now, what small thing can I do to take care of myself physically? And then do that small thing. Do you need to eat a snack? Do you need a glass of water? Do you need a nap? Do you need to take your prescribed medications? Do you want to move your body, go outside, or get off screens? Taking care of your physical health gives you a more stable foundation for your recovery. You're less likely to feel overwhelmed by emotions and more likely to have the energy and clarity you need to use other coping skills when cravings hit. Number 5 is contributing. Addiction can make you feel isolated and worthless. This coping skill helps you remember that you have something valuable to offer the world. Contributing is a DBT distress tolerance skill that involves doing nice things for other people, particularly when you're feeling stuck in your own emotional storm. Maybe you become a sponsor, pick up trash in your local park, do a favor for your neighbor, donate old clothes, or send a supportive text message to a friend. The key is doing anything that helps other people or that contributes to a cause that's bigger than you. When you're dealing with addiction, it's natural to become focused on your own problems and pain, but rumination about your struggles makes things worse. Contributing gets you out of that self-centered spiral by focusing your energy on helping others instead. It increases your sense of connection and reminds you that you're not just your addiction. You're a person with value who can make a positive difference. So there you have it, 5 DBT skills that can help with addiction. So now let me be clear about how DBT fits into addiction recovery. DBT is an evidence-based therapy that can help people manage painful emotions. While it was originally developed for borderline personality disorder, decades of research show it also helps with substance use disorders, anxiety, depression, PTSD, and other mental health struggles. DBT can be helpful for addiction because many people with addiction also struggle with emotion regulation. They may use drinking or drugs as a way to cope with overwhelming feelings. DBT skills teach you alternative ways to manage those intense emotions, but DBT is way more than just DBT skills. The DBT skills in this video are not a replacement for therapy or other treatments. Instead, DBT skills can work alongside other treatments to help you cope with the emotional ups and downs of recovery. Also, the 5 skills in this video are just an introduction. There are dozens of DBT skills. I teach many of them in my other videos and in my books if you want to learn more. But DBT skills can be tricky to learn on your own. So if you're struggling with addiction, finding a licensed therapist who specializes in substance use disorders would likely be really helpful. For help finding treatment, check out Recovery.com or the other resources in the description box below. Recovery is possible, and you don't have to do it alone. Thanks for watching.